And welcome back to Daybreak USA. Great to have you with us this morning. Our next guest is Dr. Elliott Vichinsky, the Director of Hematology Oncology at Children's Hospital and Research Center at Oakland. Good morning, Doctor, and welcome.
Good morning.
It is great to have you here with us this morning. Today is International Thalassemia Day, and this is to raise awareness of the disease and improve its diagnosis and management. Maybe there's someone out there, including me, that I have no idea what thalassemia is. Maybe we could talk a little bit about what it is and then what we need to do to help combat this.
Well, thank you. I'd like to go over some of these points.
Sure.
Thalassemia is a worldwide problem. It is a genetic disease that causes anemia, and it occurs throughout the world, but is concentrated in warm climates in Asia, Southeast Asia, Mediterranean, the Middle East, India. And as these people have immigrated over the years to the United States, it's becoming very common here.
So the National Thalassemia Day, obviously, to bring attention to this, and so the people here in the United States, would they typically be from that region then?
Typically, they would have ancestry or someone in their family from those areas.
And what are the symptoms? What if somebody said, "Well, I wonder if I have that"? What are some of the symptoms that they might be experiencing?
Well, the disease causes anemia, and the symptoms really are related to that. It makes you tired. It may make you fatigued with exercise. It may cause your eyes to be a little bit yellow. It may slow your growth. So the symptoms are really related to the anemia.
So how does the NTDT affect your health? And if you're talking about is maybe causing you to be more tired, is there actual can this be life-threatening?
Oh, yes. The thalassemia can really be divided into two groups, really. One is the severe type, and those patients have to be transfused with red cells every month for their life. And they accumulate iron, and they get iron poisoning, and they require treatment. The NTDT is the most common type, and these patients are anemic, but they don't require transfusion. But over their lifetime, they develop severe iron overload, and therefore they also need treatment.
Our guest this morning is Dr. Elliott Vichinsky, Director of Hematology Oncology at Children's Hospital and Research Center at Oakland. So what then are the consequences of the iron overload?
That's a good question. The problem is the iron accumulates in your body and goes into serious organs, and it causes death if it isn't treated from heart failure. But before that, it can damage your hormone system, so it could cause diabetes, hypothyroidism, failure of your gonads, and a number of other symptoms.
So to get the word out today being the day that we're talking about, National Thalassemia Day, International Thalassemia Day, what is the message that you want to get out and make sure everybody understands?
Well, the important message is individuals should be aware of this disease if they come from those areas. And if they have any symptoms or any concerns, they should ask their physician to be screened for this disorder.
If somebody's hearing this and saying, well, yeah, I certainly have ancestry in that region, I'd like to know more about it, where can people find more information about thalassemia?
Well, there are two good internet sites. One of them is thalassemia.com. That's my favorite because it's mine. And the other one is the National Cooley's Anemia Foundation, which is an excellent internet site, and that's thalassemia.org.
Well, Dr. Vichinsky, we thank you so much for alerting us of this and helping us to get the word out. And we appreciate you, and we'll send folks off to thalassemia.com and learn more about it.
Thank you.
Thank you for joining us. Take care.